Botox works by attaching to the surface receptor. We need a diagram for this. Okay. Botox works by attaching to the surface receptor on the surface of the muscle that receives the message from the nerve telling it to contract. So if my nerve message comes down here and gives my procerus muscle here a message to frown, that's what causes me to frown. The Botox sits on the receptor on the surface of the muscle and actually causes the receptor to be taken up into the muscle cell. So there is no receptor there waiting to receive the message from the nerve, meaning no message can go through, so we don't frown. This can be also helpful with the frown because over time, if you leave the frown without frowning, the muscle can actually become a little weaker, and that can give us an accumulated relaxation of the frown muscle. Which can mean that on successive Botox treatments, the treatment of this area can become more successful with the same dose, which is great. Okay, so Botox, currently we still price per unit because that tends to be fairly traditional in Canada, and we are $12 a unit. And it all depends on how many units you need. So a traditional dosing would be 20 in the glabella, 20 in the forehead, and then 18 around each eye. So I'll let you do the math. With patients being motivated purely by price is that what a patient wants to achieve when they come for a Botox treatment is an outcome. And the outcome is best served if we assess the patient's muscle strength, the patient's muscle pattern, and what they want to achieve, and we work out an optimized plan that takes into account the recommended units that have been established in the scientific literature. And if we deliver a well-planned treatment with the optimal product, then we are guaranteed to have the best outcome that lasts patients the best amount of time, and the patients in that way will feel they've had the best value for money from their treatment. So I'd say this was a typical first Botox patient that we have in our practice in Whistler. So the patients come in, she's got a very strong frontalis that's leading to almost like a male strength, deep furrows in the forehead. So it's no surprise when you see this patient that you can understand why, even though she's young, she's going to be seeing lines in her forehead earlier than maybe some of her friends at her age. But you can see after 3 weeks of Botox, she now has a smooth forehead and is very much appreciating that when she's animating, she's not creating these deep furrows anymore. So this was a great outcome for her. And we were really pleased to help her out. I'd say most first Botoxes are pretty thrilled with their outcomes. Hi, Dr. Sarah Kenner here, and today we're talking about the truth about Botox pricing. So a typical story of a patient who would come in having sought a kind of low price treatment might be that they've been to a clinic who is kind of doing lowish doses, may have not been injecting very long. The patient may have a slightly more complex forehead pattern to inject, and the patient comes in with an odd contraction pattern in the forehead, whether we're leaving some extra lines at the side, giving us a Spock type effect, or whether they've missed lines at the top, meaning this is somewhat relaxed and we're contracting up top, basically making the patient look as though they've had something done, which is absolutely not what we want when we're doing a Botox cosmetic treatment. So often we have to correct some of these outcomes. And I think this just highlights the importance of going to see an injector who's not just working off a paint by numbers type pattern that they might have learned within a recent period of time, but they've got the experience to know the different forehead patterns, know what dosage you require for your forehead contraction or your muscle contraction elsewhere, and to be able to deliver you the right outcome on the first time without hopefully needing to do a lot of top-ups. I feel the optimal time to start using Botox is when you just start to see the beginning of static lines. So by static lines, we mean lines that are there at rest, aka wrinkles. So say, for example, you just start to see when your forehead is completely relaxed, you start to see that you can see a little line there. That is a good time to use Botox Cosmetic. Now, a lot of patients might start to see that in their late 20s, early 30s. Some patients I've noticed, particularly Australian patients who've had a lot of UV damage, will have lines at a much younger age. So whenever you start to see those static lines, that is the optimal time to come for a Botox Cosmetic treatment, because at that point, if we do Botox and give the area an opportunity to just relax and the muscle to no longer contract into those lines anymore, what we'll find is over a few weeks of not contracting into the lines, the skin heals them all up, particularly if we use really good medical grade skincare at the same time. And then you have just delayed yourself getting wrinkles in your skin. And in that way, we talk about Botox as being preventative. So it's fairly common for us in Whistler that patients will come in their 50s, 60s, 70s, and they've never done Botox before, and they want to start at a later age. So it's just important at the consultation to have a discussion that when people have established deep lines and wrinkles, that unlike my late 20, 30-year-olds coming in when they've just started to see the signs of wrinkles, when patients have deep established lines, there's going to be a limit to how much we can get them to heal up. So obviously the Botox is really going to help them heal up, but then we often will need to do other treatments on top. For example, use some fairly aggressive retinols, use some laser, use some RF microneedling in order to get those lines to heal themselves up. And even then, there are some lines that can just be super tricky and we may not get rid of them all, but usually patients can see enough improvement that they still feel Botox is worth doing even when they start when they're older. Okay, other things we do with Botox which are not the traditional frown, forehead, around the eyes are we can treat the muscle here, the DAO, the depressor anguli oris, which goes from the corner of the mouth to here, which as you can see with me is quite strong. So we can treat that muscle if people are complaining of their mouth being downturned and they want it to be a little more upturned. We can do that. Yeah, my husband is currently signaling that he wants that done. Other places, mentalis muscles. So with age, our chin tends to do this, which is partly our mentalis muscle, which is here and here. It gets activated and starts to pull up, mainly because our chin is shortening. This becomes more active. It does this, which not only gives us this mentalis line, but it also gives us this kind of aging profile on the chin. Now, most of the time, I will want to correct that using filler because it's way, gives you a way better result. But you can pop a little Botox in here, which will help with the unfolding, which will help relax this line, and will also help that horrible, I don't know if you've ever sat in a restaurant and watched people chewing and seen the powder orange go on here, that kind of orange skin texture type thing. That drives me around the bend when I see that on people. Anyway, mentalis Botox will really help with that as well. Another of my favorite things to do in Botox, and I have an interesting video that we can show you where I've done half my face, is not only doing the DAO here, but doing the Nefertiti. So with the Nefertiti, we're treating this muscle that goes down here, which is called the platysma muscle. Now, if I kind of contract my platysma, you'll see it kind of takes away the nice jawline definition between this sharp jawline into a kind of slender neck, and it kind of makes everything kind of morph into one. So when we do a couple of little Botox treatments along here, we get this kind of much sharper jawline that is obviously very on trend, as everyone wants to show off their jawline on the gram. Okay, so bunny lines, sometimes with cosmetic, when we treat the frown area, the procerus muscle here and the corrugator muscles here, because we can no longer frown, sometimes our brain tries to compensate and does like a scrunch here with our levator labii superioris aliquinese muscle, which travels down here. the longest muscle name in the body. So it just means we can end up doing like a scrunchy thing here that can give us little lines in here, which we can contract anyway. It's not always a compensatory thing to having being treated up here, but it can happen as a compensation as well. So when we put a little bit of Botox in the lines here, we can resolve this scrunch and make sure that we don't get those little tiny lines accumulating around the nose. It's also helpful for avoiding the equator line here, because sometimes this is not only caused by the procerus muscle, but the LLSAN muscle from here. What we see a lot of is patients coming to see us, and they may have been to a clinic where they thought they were going to get a cheap treatment, and what happens is they're not dosed with enough of an adequate Botox dose to give them a good result, a good balanced result, and decent longevity. So sometimes what happens is they'll then come and see us in a few weeks and say, oh, it's not quite what I was after, it doesn't seem to be lasting. And then we'll explain to them that there are actually recommended doses that are have been established in science for Botox. And if we stick to these doses, we very often get really optimal outcomes, and we get longevity that extends far beyond what we're getting with smaller units. And in that way, it delivers better value for money, because patients are getting optimal results that last way longer. Meso Botox is another thing that we do that can be used to just give an essence of a beautiful skin quality. So patients who have their Botox done for the traditional kind of frown, forehead, around the eyes, will notice that their skin gets this beautiful kind of dewy, glowy thing. Now we can use a very dilute Botox being diluted in the skin and peppered through the skin here to just give an improved skin quality, reduced pores. Some patients have reported reduced melasma, reduced reds. Basically, Botox seems to just do wonders in the skin. The skin loves Botox, so why shouldn't we be using it all over the skin for that beautiful skin quality effect? So what is a biostimulator in the body? A biostimulator is something that we often will be injecting into the skin, and the idea is it actually changes the underlying biochemistry, physiology of the skin in terms of making it act more youthful. So the classic one would be Skin Vive, that we're talking a lot about at the moment because it's part of Glowtox. And what that means is we inject lots of tiny little micro droplets into the dermis of hyaluronic acid, which is exciting because it makes the skin look more plump, so there's an instant to it. But what's potentially even more exciting is they've shown that by having this extra hyaluronic acid in the skin, it regulates our elastin fibers, and it regulates other transporters that can become more absent in the skin as we age, such as aquaporin 3. And what that means is the skin is able to act younger. So using biostimulators that encourage the skin to act in a more youthful way is a really exciting thing in the aesthetics industry, and it's something we're going to be seeing more of. There are many neuromodulators on the market. Botox Cosmetic is the original, and by a long way the most evidence-based toxin that's on the market. There are other ones such as Xeomin, Dysport, Nuceiva, Latabo, and there will be potentially other ones that are coming along the market. My favorite toxin will be Botox Cosmetic. We also use some Xeomin, but they are my favorite toxins.